role is pediatric registrar working in a busy DGH, setting clinic room in the outpatient department. You are talking to Mrs. Barwick, mother of a 7-year-old Edwin. So background information, Edwin is a 7-year-old boy who has a diagnosis of hereditary spherocytosis. He is seen regularly by the hematologist and the pediatric team. Due to recurrent hemolysis, he is going to have a splenectomy under the care of the pediatric surgeons in 2 weeks' time. He is an otherwise healthy child. Mrs. Barwick has given consent for surgery but remains worried about the consequences and has asked for further appointment to meet you prior to the planned surgery. So the task is please talk to Edwin's mother and try to address her concerns with regard to Edwin's diagnosis and forthcoming splenectomy. So the role player is Dr. Rohel and the candidate is Dr. Nihal. When you both are ready, please let me know.
Okay.
Okay, I'm ready.
Okay, so you start and I will set the time.
Okay.
Start. Okay.
Yes, you may start, Dr. Nihal.
Okay. Hello. Good evening.
Hello. Good evening, doctor.
I am Dr. Ibrahim, one of the children doctor. I believe I'm talking to Miss Barwick, mother of Edwin.
Yes, doctor. Hi, Mrs. Barwick.
Yeah, nice to meet you, Miss Barwick. Today I'm here to speak to you about Barwick condition and some issues related to him. Is it suitable time for you to start?
Yes, doctor. You can start.
Yeah. Feel free to ask me at any time and to interrupt me if anything unclear.
That's perfect. Okay.
Uh, First, I want to ask you, what do you know so far about Barwick condition?
Doctor, I don't know actually so much about this. Barwick is having the condition hereditary spherocytosis. So this is something in the families, I think so, runs in the family. So he is having a problem with that, and every few days, every few months or few days, he needs blood transfusion. So I am quite worried. I want to know what is this condition, why it's happening so.
Yeah, I can appreciate your concern. Actually, this, as you mentioned, hereditary spherocytosis is a kind of blood disease. As you said, it runs in families. In this condition, the blood cell has a problem in the membrane, so it become a spherical shape. I mean, it become more circular. Not like the normal blood cell, which is like this shape.
Oh,
Am I clear?
yes, doctor.
Yeah, that is why their blood cell is destroyed easily and and make him anemic.
Okay, doctor, but okay, I got that.
So the hematological team takes the decision to make.
Doctor, is there any chance
What?
he can be cured or not? Is there any chance?
Actually, there is no curative treatment, but we are going to do for him what we call splenectomy. It will help him in this condition.
I didn't get, doctor, what is splenectomy?
Yeah, I will explain for you. Actually, spleen is the large organ found in the on the left side of the tummy. I mean, if this tummy spleen is found here on the left hand side, this organ responsible for removing the all blood cell from the bloodstream, and also fighting against infection. Am I clear, Ms. Barwick?
So, doctor, why you want to remove it? As you told me, this organ is fighting against infection. So my child will be at the risk of infection. Why you want to remove?
Yeah, I totally agree with you. I can understand what you're thinking, but we are going to remove him because we are weighing the benefit against the risk. I mean that the risk from destroying the blood cell and the other benefit regarding fighting the infection. So we need to remove this organ because it is regular. If we keep it, the blood cell is going to destroy, and we will lose more blood, and we will need more blood transfusion. So to cut this
Okay,
circle,
doctor.
we are going.
So
Yeah.
what will you do? You will remove this organ. So as I told you, my child will be at the risk of infection. So for that, you will do anything?
Yes, yes. We are going to give him antibiotic. It will be for life to guard against infection. This antibiotic, we call it penicillin. Also, we will ensure that there is adequate vaccination by giving him doses of what we call pneumococcal vaccine 4 to 6 weeks before the operation, and other vaccine we called him meningococcal vaccine also,
So doctor,
and
these vaccines will be once in a life, or as you told me, this what you say, antibiotic will be for the rest of life. So this vaccines will be only for once
yeah.
in life.
Actually, this vaccine will be given 4 to 6 weeks before the operation, and then a booster dose every 5 years will be given. Am I
Okay.
clear?
Yes,
6 minutes.
absolutely.
6 minutes.
So what
Yeah. Do you
should
have
I
any more?
do at home? Yeah, what should I do at home? Anything you want to tell me? You want to give advice?
Yeah, this is very nice question. Uh, Edwin will be sensitive, will be more sensitive than the other children for the infection. So you have to keep your eyes on him. If you found him with high temperature, or a little bit drowsy, or he feel any abdominal pain, you have to see your doctor.
Is there
Am
any
I
alternative
clear?
to this, doctor? I am little afraid. You know, this is such, you want to remove this organ, so I am little afraid for my child. Is there any alternative to this?
Yeah, I can understand your worries. Actually, the only alternation is blood transfusion, and we give him too much blood transfusion in the previous period. So we are going for this one. The surgeon will give you more detail about the surgical operation, and it is operation with some risk
Okay,
get infection or
okay, doctor. Is there
yes.
anything you specifically you want to advise me for my child after that
Yeah,
procedure?
after is Yes, after procedure, you have to wear a bracelet or you have to carry a card, a splenectomy card, to make him notice that he had splenectomy before.
Okay, doctor.
Do you
Thank
have
you.
any? Yeah. Do you
Yeah.
have any more questions?
No, doctor. Thank you very much.
Yeah. Thank you for you. If I can sum up what we spoke about today.
Yes.
Today we spoke. Yeah. Thank you. Today we spoke about hereditary spherocytosis and splenectomy. We explained the function of spleen and how what we are going to do before the splenectomy, like giving antibiotic and ensure adequate vaccination, and also the red flag when to see the emergency department if there is a temperature, high temperature, and you have to carry a splenectomy card. Thank you for your coming. I will give you some leaflet information
Time is up,
more.
doctor.
Okay. Thank you, doctor. Yeah,
Okay, Dr. Rahel, your feedback, please.
yes, Dr. Nihaz, you did very nicely, very beautifully, and
So
you should be so
I
little
didn't.
little bit
Yes.
should be more fluent in the while you
Yes.
are talking, so you can
Mm.
completely cover the one thing. And I think maybe due to internet you were not listening me. There was overlapping little bit, but maybe this is due to internet. I think so. So others, you have not given any wrong information so far. Yes, you will have to given this every 5 years booster you have to give, but only for hip there is no booster. Only hip is giving only for once in a life. And you have used the word membrane. You can use, this is a simple word, but little bit is, I think so, for a layman it is different. You can use a kind of layer or something, I don't know. Membrane is not yeah,
Covering
covering you use.
of the
And
red cells.
yeah, covering of the red cells. And one anemic, I don't know anemic is jargon or not, I don't know, but you have used the word anemic.
Mm.
And
Splenectomy.
Yes. Anemic. Yes.
yeah, splenectomy she has used this
No,
word splenectomy, and she
upon your
explained that
exploration, no, actually it was deliberately uttered by her, and usually you should say, we will remove the spleen. Reason
no,
behind.
no, doctor
Okay,
doctor
you just
Dr. Irfan, if you have deliberately or you have by uh, as a doctor you have said this, you can explain. Then she explained that we will remove the spleen. That's why I
yeah,
asked
yeah.
why you want to remove. So if you have said any word, you can. If you have explained, then it will be not a jargon.
Okay. Next
Actually,
इजाजत है now इजाजत.
in the scenario, she has already given the consent, so she knows what is operation is there. So we should look
Yes,
the
yes.
scenario as well.
That's why she didn't ask me for my permission,
Hmm.
and that's good. Already
Yes.
has given. She has already given. She has some concerns, so she was not coming to this bracelet
Okay.
or splenectomy card.
Yeah, yeah.
So I asked by myself, and she told me. Maybe she forget. I don't
Hmm.
know.
Bracelet
And
was
one more thing.
necessary.
Yeah, this is actually this scenario is there are 4 A's which I usually use. Alarming signs we should tell about the alert, bracelet, action plan, advice. These are 4 things
Hmm.
which we should tell about any procedure, I think so, most of the procedures.
All,
Yeah, this is 4 A's. And one more thing, when I ask any alternative, so alternative she's said that
Mm.
that was nicely she said that we regular blood transfusion, and this is less practical. Yet in the long term she may have some problems in the other organs from the transfusions, and transfusion reactions can be there, or iron overload damaging the
Mhm.
organs. So she can say like this.
Ah,
Otherwise that was
yes.
fine. And I have said this 4 A's, but now I seen that alternative is also from A. So 5 A's. I will write in my book. So 5 A's we can use in this kind of scenario.
Okay, write it in the group so we can revise it together.
Yes.
So how to explain about that hereditary spherocytosis, what it is?
Hereditary spherocytosis, you can say that this is a condition which runs in the family. Usually, not usually, this is runs in the family.
Usually, no. You can say
And
there's a defect.
yeah,
No.
I'm coming.
Yeah. Okay.
I'm coming to
Carry
that.
on.
In which these cells in the blood, we call red blood cells, which have this covering of the red blood cells are fragile. So they become in spherical that can easily be trapped from the organ spleen, which easily remove these fragile red blood cells. So that's why child is having getting paler after few days. So you can say like this. This is actually
So we
Can
see
you
like that.
explain about
fragile.
gallstones?
No, actually, we can say like that. This condition, in this condition, the red cells covering has a defect that gives the shape of circle, and that is not usual. And they are more prone to damage or breakdown.
Mhm.
So that's
Yeah,
why maybe the child is having uh, uh, frequent anemia and need the blood transfusion. Okay, then we should explain there is an option for us, and there is a that is to remove the spleen. Then tell the subfunction of spleen. Okay, for the removal of the exhausted or worn out cells. So these cells are as having not normal shape, so they are broken down frequently by the spleen. So removal of spleen will help in this condition. Actually, the function of the first of all, spherocytosis was not explained in a properly, and spleen function was not explained. What is the main defect in spherocytosis, and what is the function of spleen? Why we are removing?
Yeah, because scenario was not
no,
this. Actually, scenario was splenectomy, so it's okay if she did not explain. Just I'm asking for my knowledge. I don't know actually how to explain.
no, she said that she said the spleen
Mhm.
is to remove the this is the organ which remove the red blood cells and fight against the infections. She said.
Yes. Okay.
Mhm. What about gallstone? Shall we address gallstone, or we have
If
to
they will
wait
ask
for
you,
their asking?
otherwise no
If
need.
they ask, okay.
If
How
if
this
they ask,
splenectomy will reduce the traumatic rupture of the spleen?
If it is a big size and the child plays sports, active sports, then the chances of the trauma is there, and it can create a
Okay,
sudden emergency
rupture.
situation,
Okay,
which
yeah,
can be.
that's right.
okay,
After
We should avoid this
after
contact
after
sports are having.
removal, you have there is no chance of traumatic spleen. Simple.
no
Yes.
spleen,
When
no
you remove
rupture.
it,
Okay.
it's quite obvious.
So
But they'll
that
remove
is
all the
Yeah.
spleen, or they
that
We
is
will
one of
remove
the
spleen.
indication you have to
total
explain.
splenectomy.
That is one of the
No,
indication we
we are
explain
talking
to the role
we
player,
are
like
talking
this
about
is the reason.
spherocytosis at the moment.
Yeah.
So we will talk like that. And if he is not, we are not removing spleen, there is a chance he may get the trauma to the spleen.
Yeah.
And they will get the
And Dr.
splenomegaly.
And Dr. Raheen, what about H influenza type B? As you said, Hib vaccination once. I had it every year in winter.
Uh, actually they are giving this actually 4 vaccines are using. One is pneumococcal and one is meningococcal C and one is Hib. The one is influenza.
Mm.
Influenza they are giving every year, and meningococcal booster is giving every 5 years. But Hib is there is no booster. They have written this
Hib is
in
every year, na? In every year, I think in winter weather, right? Before winter.
influenza. Yeah, influenza every year in the winter weather, and meningococcal and pneumococcal is every 5 years booster. They have written in this Nelson, I think. And Hib is, there is no booster for Hib.
But Hib is influenza, no? H influenza type B. Anyone else has?
That is a
No,
bacteria,
this is
Dr. Bakar.
after
Bacteria.
influenza type B. This is bacteria.
What
One is
he
And
is
I'm telling
vaccinating
you,
Okay.
influenza
is there is
virus.
one is flu
yeah,
vax that we are giving an high risk patient.
flu
So
Flu
he
vax
will
is
vax,
become
flu
high
vax.
vaccine.
risk
That is
every
every
year.
year.
Yeah.
Yeah,
Okay. This
that
is
that is
separate. This
every
is
year.
different one. Hib is
Yes.
different.
Yeah,
Yeah,
very different.
Hib
And
is different.
secondly, Dr. Rohel and Dr. Nihad, what is the time period for giving the vaccine? When to give?
Vaccine usually 4 to 6 weeks before splenectomy, but at least should be 2 weeks.
2 weeks. 2 weeks is the answer,
No, no,
basically.
Dr. Irfan, this is, I have
Uh-huh.
read from this Nelson. They have written 4 to 6 weeks is ideally. At least should be
Okay.
2 weeks.
At least.
Yeah,
If you
at
have,
least should be.
okay.
Okay. So anyone else has the comment about this communication scenario?
Actually, this was very nice, Dr. Nihad and both Dr. Rohel. It was flawless communication. I feel it was very good. She covered the all agenda. Everything was covered nicely within the time frame. So absolutely fine, perfect.
Thank you so much.
You're welcome. So very nice.
So shall we go for the history?
Yeah.
Okay.
I will be the instead of Dr. Sandeep.
Sandeep is absent today, and he given his turn to Dr. Hiren.
Yeah, he
But
takes.
next time, if anyone absent, so it depends on me to whom we choose, right?
Uh-huh.
Okay. So this one is history. It's
You want to do? You
premature
want to
baby
do?
with
Dr. Vakar, you
no,
want to?
no, I don't know. I didn't prepare for it.
Okay, because he had something, so he just texted me on the
Yeah,
web.
he messaged me as well. He
Hmm.
texted me as well.
He asked me
He
if he
told
could
me.
do. I said, okay, no problem.
Yeah, no, just I'm kidding. So
Which is
Dr. Rifat is role player in this. It is the case in Mark BT on page number 27, right?
Yeah.
So I'm just reading this. The role is you are a specialist trainee in a district general hospital. Setting is outpatient clinic. You are talking to Jess, mother of
Time.
Samuel.
Hello, can you hear me? What is the time?
Yes.
It is
Yeah, we have to reconnect. After this, I will reconnect.
okay.
2 minutes you will get this preparation. I will reconnect after scenario.
No. If you
So you are talking.
if you are reconnecting better, because the recording also will stop. So the whole of history will come as in one recording. So if you are planning,
You want history should be in one recording. Okay.
yeah, that
Okay,
will
no
be fine.
problem.
that is better.
I
Okay.
will reconnect it.